Well, hello. Thanks very much for joining us. I'm Dan Bloom. I'm the Mirror's online political editor, and I'm joined for the first time by our new senior political correspondent, Rachel Wearmouth.
Hiya.
We're going to talk a little bit about the restrictions lifting that was announced yesterday for July the 19th in England, and take some of your questions and talk about some of the ways that this is just a little bit controversial and maybe not going down so well with everyone, despite the fact that we are all desperate to get out of our home offices here. So what did Boris Johnson announce last night? You probably all saw the press conference, but let's go back over it anyway. From July the 19th, there will be no legal limits on social contact in England. The rule of 6 indoors is scrapped. The rule of 30 outdoors is scrapped. You can go to a nightclub at full capacity. You can go to a gig in a stadium or a sports match or a theatre show or the cinema, all at full capacity with no masks. Social distancing, the 1 metre plus rule is scrapped. Ordering at the table in a pub, that's scrapped as well. You can order at the bar. Face mask laws, one of the most controversial ones, those are axed as well. There's absolutely nowhere it will be a legal requirement to wear a face mask. The working from home mandate is axed, although it will be down to individual firms to decide whether they send their staff back in. And you can have more visitors in care homes. And we're getting more announcements today. We've got 2 big statements in the House of Commons at lunchtime. The first one is going to be on scrapping self-isolation for people who've had both jabs later this summer, if you come into contact with someone who's had COVID. And the second one is going to be about scrapping school bubbles. It's the same principle. So we will have a system where if your kid comes into contact with a COVID case and they're not sick themselves, they won't have to go home from school, because we've had hundreds of thousands of kids missing school. Now, all of this is great for sort of freedom. And if you take it outside of the virus itself, it's good news for a lot of people and a long time coming. But why is it not going down quite so well, Rachel?
I would say the most controversial of the measures that were announced yesterday is the lifting of the restriction for face masks. So I think this is making quite a lot of people really quite uneasy, not least because we've got something like 20 to 20,000 cases per day at the moment. And the government is not saying, as was the original expectation, that we had to see the link between hospitalisations and deaths severed, broken. They're simply saying at the moment it's severely weakened. And we had the Health Secretary, Sajid Javid, on the radio this morning saying that his expectation was that we could see cases as high as 100,000 this summer, which will alarm pretty much everybody. And I would sort of look at some of the analysis that was made by Professor Neil Ferguson this morning, also known as Professor Lockdown. And his analysis today was that he was looking at how cases could rise and what that would mean at the current level of severing of this link would mean. And so if we're going to see 100,000 cases per day by the summer, according to Professor Ferguson's analysis, that would mean around 100 deaths per day. And that could mean something like 15,000 extra deaths by the end of the year. And I know that the government's sort of response to all this is that we have to learn to live with COVID, and we have to figure out what we believe to be, an acceptable level of hospitalizations and deaths. But I guess a lot of people would counter that they don't feel consulted by this. And there's been a lot of backlash, particularly to the lifting of the restrictions for masks. Keir Starmer, the Labour leader, for example, has said that the lifting of all restrictions at this time seems to be reckless when we have cases at this level. And we have people like Sadiq Khan, the London mayor, saying, asking Londoners to continue, or at least to continue wearing them on the tube, where, we'll have a lot of close contact. And if we're about to see working from home end, the tube's about to be a lot more busy. Yeah.
There's sort of 3 big sticking points, aren't there? So the first one is on masks. They're saying over and over that you can make a personal choice on whether to wear a mask and to protect yourself. But wearing a mask protects the people around you more than it protects yourself. So how can you trust people to make an informed decision to protect strangers who they've never met? The second problem is that before we had these models, however inaccurate they turned out to be, of a number of deaths that were predicted from easing lockdown that would come over the next year. And this time, as far as we can tell, we haven't been given those actual models. We're kind of relying on slightly back of a fag packet calculations, and Sajid Javid going on the radio and saying, oh, I've seen something internally that says we'll get 100,000 cases a day, but I'm not going to tell you the details when it comes to hospital and death. And then the third big problem is this all irreversible? So Boris Johnson said, didn't he? He said it would be cautious but irreversible. And then last night he couldn't promise it would be irreversible at all. He actually sort of sounded like he was edging towards shutting down a bit this winter, didn't he? Because he said, if we don't do it now, we might not be able to do it. Then that kind of implies that things are going to get worse from September like they did last year.
Yeah, and I don't know what the big problem is with just a little bit more transparency, really. You know, I mean, we're the people who everybody has to live with the virus. So we should know what the government's dealing with, because ultimately we have to deal with it. And one thing that we sort of haven't discussed is that allowing case numbers to rise to levels like 100,000 does make it perhaps more likely that we're going to see some kind of variant. And everyone's biggest fear is that we're going to get a variant that's vaccine resistant. And when Sajid Javid was interviewed this morning, he couldn't, guarantee there were any additional protections against that as we go forward with this plan. So, and I think it's sort of one of the aims, I would guess, of Sajid Javid's approach here is, I know he says that that he has other health problems to consider. He mentioned mental health and domestic violence that he wanted to deal with. He didn't mention social care, funny enough, but he said that there were other health concerns that he needed to deal with. But some of it will be driven by a need to get the economy reopened. But I think a lot of people will find this kind of rushing towards the destination rather than staggering these measures. I think they'll find it profoundly not reassuring. And I wonder if that's going to have the impact on the economy even that he wants.
Well, speaking of rushing towards destination, however uncomfortable people are, we've been leaving poor Kelly hanging for a long time. And then we'll hear from Grant Shapps on travel. And this just shows the argument, doesn't it, that people really want to know how they're going to open up further. Now, as you know, Kelly, as you probably know, the travel rules haven't sort of changed from this July the 19th thing. We still have the amber, red and the green lists. So those will just be updated every 3 weeks. And I think the next update is due kind of late next week for around July the 19th. So that's when you'll know more about when you can go on holiday. But the problem that's looming, I think, is if the UK is pushing a policy of letting the virus run rampant because most of our population is vaccinated, then there might be some pretty harsh rules on Brits having to quarantine at the other end when they get to European countries. So even if somewhere's on the green list, we might not be able to go there very easily. Karen asks, why not phase steps in and monitor the COVID cases? That is exactly what some people are asking, Karen, and that's kind of what they suggested they would do. And they had suggested, hadn't they, that there would be more of a sort of more heavy-handed guidance, perhaps, even if they did scrap all the laws, didn't they?
Yeah, and I kind of this sort of, I guess, marks the new approach of the new health secretary that we have, and it does kind of underline that Matt Hancock was more cautious in his approach, and but I think as Dan was kind of referring to a little bit earlier, we don't know whether any of these measures at the moment are irreversible, and if the government starts to see data that it makes it uncomfortable, whether we might see some kind of stepping back from the approach we have currently. And I think a lot of sort of people in the Labour Party and elsewhere made a good point yesterday, and that was that the current restrictions that we have were due to come to an end on July 19th in any case, and renewing them would have required another debate and vote in Parliament, and there are an increasing number of Conservative MPs that are really hostile towards continuing restrictions. And I think Keir Starmer made the point yesterday that there is an element of party management here from the Prime Minister.
Yeah, because there are certain things which are just the disruption to society is so unarguable, isn't it? Like schools, when we're going to have new pupil attendance figures out at noon today, and they're probably going to show again hundreds and hundreds of thousands of pupils are having to miss school after all the disruption they've had. No one can argue that you've got to strike a balance there between pupils and the virus and their future. But I think that's why masks are going to be such a sticking point, in my opinion, because masks are like they're almost a theoretical freedom thing. They're a sort of academic level of, you've got Tory MPs saying it's the principle of the thing. We need to be free to go about our business unmasked on public transport. In reality, how much irritation or how much do masks really upset your life unless you have a condition that means you're exempt anyway? It's just a bit of paper over your face. And that's why it's so much anger about this, because it's kind of, disabled people are being nudged towards, well, why don't you travel at 5 a.m. instead of at peak times, basically, so that people can have their freedom. And it's who's got the real freedom here?
Yeah, and when it amounts to simply just a mask that helps other people live more freely and includes others, it's not really a massive inconvenience to wear a mask, is it? It's just, I mean, nobody likes to wear them, admittedly, but and I would include myself in that. It's not great to wear a mask. It's not something I would choose to do if I didn't have to. But I kind of think it's about protecting others, isn't it? It's not just about how you feel about your day.
This is all about the balance as well. In Michael's question, can I go to the doctor, or will I have to wait outside the surgery to be seen? As far as I know, don't know what your doctor's surgery are doing, but they've made a real effort to make sure that people can be seen for all sorts of things, including long-term problems or sort of chronic low-level stuff. And the reason for that is because we've got such a backlog in the NHS and such a danger of people with perhaps small problems that that might turn out to be something serious. You've got lots of people not coming forward for cancer diagnosis and things like that. So, Michael, you might have to stand outside in a marquee. I don't know what your doctor's surgery is doing, but you certainly shouldn't stop yourself from making an appointment. Now, Tina's question is interesting as well, isn't it? Because she says, I'm a social worker. Will we still have to wear masks? And there is going to be guidance on masks in healthcare, which includes care homes. And that is the only place where there will be specific guidance to wear a mask, but it's not the law. And it's not going to be the law anywhere, not on planes, not on trains, not in automobiles, taxis, not in shops, the rest of it. So there's a real problem here. And, hopefully, Tina, there will be a balance struck where people kind of, because their staff working with people will put the needs of the residents first and do what they need to do. But it's all becoming a little bit more fluid and almost just judge it for yourself and do what your boss says. Am I right?
Yeah, we had an interview with the care minister yesterday, Helen Waitley, didn't we? And she said she expected PPE would continue in care homes where there were more vulnerable people and those who would be more severely affected if they did contract coronavirus. And I think one of the things that Chris Whitty, the Chief Medical Officer, was at pains to point out yesterday was that he would wear a mask in settings where he was asked to, as he would see it as a common courtesy. So I wonder if those are the kinds of statements that the government will now be pointing us to.
Yeah, it's funny, isn't it? It's almost like he's sort of Boris Johnson's responsible older brother who Boris Johnson asked, would you wear a mask? And he sort of fumbled the answer, and then Chris Whitty says, well, here are the situations I'd wear it, and it's just common decency to do it if someone else is uncomfortable. And then after that, Boris Johnson said, yes, I would do exactly the same thing. Thanks very much, Chris. I agree with Joanne. I can't wait to have a dance again either. Where will you go first when you're fully vaccinated, Rachel? What's your what kind of
you know what, I can't wait to go to a gig. I've really missed live music. I mean, I've been back to the cinema already, but yeah, I really, really miss live music. So I would very much enjoy a gig once I'm fully vaccinated, which I'm not quite yet. So I've only been single jabbed at the moment. So, but I do have.
I'm counting down the days to my second jab, and hoping it's difficult, isn't it? Because I don't speak for anyone but myself, but there is a nervousness that comes after 15, 16 months of living a life this way, that you can't just flip a switch and get back to it. But maybe that's because I'm in my 30s and people in their 20s will say, all right, get out of our way, old man, and log back. So, well, Sabine has an interesting tactic. I actually saw someone doing this early in the lockdown. There's a friend of mine who took a 2 meter long room hat. Well, I can't argue, Sabine. That would be quite good at keeping people away, wouldn't it? But I'm not sure it's quite going to work on the tube or on public transport outside London either. You might annoy quite a few people with that. I'm afraid I don't know the answer to maternity services, George. I'm not sure if you're asking as an expectant mum or as a midwife or something else, but I think that after a lot of disruption early on, when partners couldn't actually be at the birth at first, they changed the laws very, very early on. And they said that a person giving birth could have someone with them, and that was an exception to the law. So I expect that there aren't wild changes, but I don't know if you know more, Rachel.
I don't think we've had any specific guidance on maternity services in particular. I know that we've had the announcements overall, but I don't think they've put anything out new in terms of maternity services. But we can certainly have a look at that today just to find out exactly if they have announced anything. But I don't believe there's anything new announced.
Yeah, we've had a whole load of government documents sort of dropped last night, which I must say I don't think anyone has waded all the way through yet. So that is potentially a mine of new information and of things that hopefully won't contradict what Boris Johnson said last night, because that has happened before, but I guess we'll find out.
Has it? Surely not.
No, absolutely not. Tina Collins is back. Thanks, Tina. Interested reader. If we don't have to wear masks to travel, will we still have to pay for PCR tests on return from holiday abroad? You have touched on something here, Tina, because something we picked up on yesterday is you don't legally have to wear a mask on a plane anymore, but you will still have to socially distance in the arrivals hall, which seems like a bit of a ridiculous policy. And yes, Tina, you will have to pay for the PCR tests for the moment. They are looking at scrapping quarantine for people who come back from the amber list. At the moment, it's just the green list. But with the green list, you still have to get tested. And I do believe that they would keep some of the testing for the amber list too. They might just dial it down a bit if you're double vaccinated. So I'm afraid that one's there to stay, Tina.
It's worth pointing out that some airlines are still insisting that people wear masks, so it's worth checking. I can't remember which operator came out yesterday, but they said they were still going to insist that people wear masks.
Yeah, that's the thing, is it's up to the individual companies, but it's difficult when it gets to the trains, because there's been some talk of individual transport operators like Transport for London or Greater Manchester or something saying, even though it's not the law, we're saying that as a condition of travelling on our trains, you've got to wear a mask. Problem there is that you might brush up against things like equality law and that kind of thing. And insiders and the authorities are saying it's going to be pretty difficult to actually get that going.
Plus, if there's no legal force behind it, why should people necessarily pay any attention to you?
Well, there's legal force behind the one on public transport now, isn't there? And you walk down a train carriage and, it's one carriage you walk down, everyone's wearing them, and another you walk down and it's only half or a third of people. It's, same as everything. Christiane asked a couple of things, I think. We just had one flash up about no masks for the G7. Well, you may notice that there was a bit of a rise in cases in Cornwall after the G7, so perhaps they should have been a bit more careful. But this is the problem. Any big event, it can turn into a sort of super spreader thing, and you can end up with a bit of a long tail and a legacy from that. And she also says, stop doing the tests in schools. My son has missed 10 days of school, went back Friday, and now been told someone else is positive or off again. And that is what they're announcing today, Christiane. As far as we can tell, they're going to basically relax it so that if your son is in contact with someone who has COVID, doesn't have to come down, come out to home for 10 days and kind of won't disrupt your life in that same way. How exactly that will affect transmission, I mean, I guess we've yet to see.
Yeah, but I guess this is a replacement to the bubbles policy, where if one person contracts coronavirus, and that everyone who's in the bubble within the school kind of has to go home and self-isolate. But that's I think this figures at the moment is something like 375,000 kids were off in the last week. So this kind of blunt tool of the school bubble policy is really causing a lot of disruption to kids' education, isn't it?
Yeah, it's the next big crisis, isn't it? Until we get through the 5 other crises that are facing us now. I think we'll wrap this up and call it a morning, because we've got to go off and write about all this stuff now, haven't we? So thanks very much for joining us, and being so kind to Rachel on her first time live from her old job. And we'll see you next time, and I think you'll see Fleet Street Fox tomorrow for the usual news agenda. So until then, cheers.
Cheers.